Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 7 of the podcast. Today is February 17th, and we are already halfway through the month of February, which is so crazy. This year is really flying by. There's a funny statistic in the podcasting world that so many people start podcasts, but they don't make it past the 7th episode. They call it the pod fade phenomenon because it's a lot more work than what people anticipate as far as producing the show and creating new content each week and getting people to show up on a regular basis. So we're excited to break that trend, and we're in it for the long haul. Rain or shine, sick or not sick, we are here to stay every single Monday. And I do apologize for my voice. My kiddos got me sick, and if you have young kids, you know how that goes. When they get sick, the whole family gets sick. So I apologize, and I'm going to do the best I can to make it through this episode without coughing in your ear. Our topic for today is going to cover my top 5 pro tips for reporting online evaluation and management services. These are the new e-visit codes for 2020. I've gotten a lot of questions about these codes. So before we dive into my pro tips, it's time for your Monday dose of positivity, the Mindset Monday tip. And it's brought to you by Project Resume. When is the last time you had your resume updated? Your resume is literally your entry ticket to that next great opportunity. Project Resume will design a customized ATS friendly resume to demonstrate your unique skills and experience. And even better, it's written by coders for coders. Make that investment in yourself today. Visit projectresume.net and mention my code ALPHACODING for special pricing. So our Mindset Monday tip is all about work ethic and the power of hard work. I post a lot on social media about hard work and why it's so important, because I think many people see successful people and they automatically assume they just stumbled into success. Let me share something with you. Hard work is part of every successful person's journey. And I'm not talking about a few weeks of hard work. I'm talking about years of putting your head down, knee deep in the trenches, putting your time in and doing that hard work, because that's what it takes. One of my favorite quotes is, "You don't need $1 million idea, but you do need $1 million work ethic." Hard work works, so keep grinding every single day. It's going to pay off. So our topic for today is going to focus on my top pro tips for reporting online evaluation and management services. We discussed this briefly in episode 2, but even since then, there have been some updates and changes. So I want to dive into this a bit deeper. There's a lot of infrastructure that needs to be in place for your organization to successfully report these communication-based technology services. So this brings me to my pro tip number 1. Understand the difference between online evaluation and management services versus online assessments. So according to CPT 2020, online evaluation and management services are used to report online evaluation and treatment and are for use by clinicians who have evaluation and management in their designated scope of practice. Now, CPT goes on to further define online evaluation and management services for clinicians who do not have E&M in their scope of practice. So this is where it gets very specific to the insurance payer. So according to CPT, online E&M services can be provided by both physicians and non-physician providers. Well, according to CMS reserves the terminology exclusively for physicians, advanced practice nurse practitioners, and physician assistants. So language is very important, and understanding the differences between the CPT definition and the CMS definition is absolutely critical. And this brings me to my pro tip number 2. Know the codes for reporting online evaluation and management services, as well as assessments. So for CPT codes 99421 through 99423, these are online evaluation and management services for physicians, nurse practitioners, and physician assistants. These are providers that can independently report Evaluation and Management Services, whereas CPT codes 98970 through 98972 are for online evaluation and management services provided by speech language pathologists, physical therapists, occupational therapists, social workers, and dietitians. So these are for the non-physician providers. And CMS has stated they do not cover these codes. So it's really important that the insurance type is noted and the appropriate codes are used depending on the payer. And then for CMS, they are requiring HCPCS codes G2061 through G2063 for the online assessment services for speech language pathologists, physical therapists, occupational therapists, social workers, and dietitians. So they're essentially the cross codes, but the language is very important. So you want to make sure the clinical documentation states online assessment rather than online evaluation and management service. And another thing to keep in mind is that there are established RVUs for these codes, which means they're being covered, and providers that are compensated based on work RVUs are incentivized to use these codes. I know sometimes with new codes, they come out, we have a CPT code for them, but then we find out that there are no allocated RVUs for the codes, which makes them pretty much useless as far as reporting for reimbursement purposes. So it's nice to know that they are allocated as far as RVUs. Keep in mind, CMS does not have allocated RVUs for the 98970 through 98972 codes, because they are requiring the G codes to be reported instead of those. So those are considered non-covered. And this brings me to my pro tip number 3. Understand the time thresholds for each code. So the great thing about these codes is that they have some consistency. I know with some areas of CPT, it can be very inconsistent as far as the codes. So CPT codes 99421 through 99423 are based on 10-minute increments. So anything less than 5 minutes is not reportable. For CPT code 99421, this includes 5 to 10 minutes. And then for 99422, 11 to 20 minutes. And then for code 99423, 21 or more minutes. This is where it becomes really important that the provider quantifies the amount of time that's spent on the online evaluation and management service. And then for the codes 98970 through 98972, same exact concept applies here. 5 to 10 minutes, 11 to 20 minutes, and then 21 or more minutes. And then the G codes are exactly the same. So that's where it's really nice with the consistency. You want to make sure that the documentation clearly states the amount of time that was spent on the service, because that's going to be critical to your code selection. So understand the time thresholds. And this brings me to my pro tip number 4. Understand how patients become eligible for these online evaluation and management services. This is where it gets even more complicated. So number 1, the patient must be established to the practice. And you want to refer back to your CPT rules on the new versus established patient designation and how to meet those requirements. But an established patient to the practice with a new or established problem. So these services can never be reported to new patients. Also, the service must be patient initiated through a secure HIPAA compliant platform like a patient portal. So how can the patient initiate this if they don't know it exists? How can we educate them that these services are now an option? And we do that by signage and patient education and giving our patients resources to use these services, because they're not just going to know that they need to request these services to get them. So that's going to take a lot of upfront work in your organization to make sure that you're complying with that requirement, which is the patient must initiate the service through a secure HIPAA-compliant platform. Also, your patient consent must be documented. CMS does allow physicians to obtain a single annual consent form for all communication technology-based services. So you need to do this at least once a year. And then keep in mind there may be some cost sharing involved. So these services most of the time are not free, and they're going to depend on the patient's insurance as far as what their cost sharing is. But that's one of the main reasons why we have to have that patient consent. Keep in mind you can't report any of the e-visits that fall under a procedural global period. So if your organization provides a lot of surgeries or procedures, you want to keep in mind what the rules are as far as global periods, and these e-visits are considered inclusive to that global period for things that are being addressed in the global period. So that's where it gets a little bit more complicated. There are also frequency limitations on these codes of 1 time per 7 days. So if you do multiple days of going back and forth with a patient, keep in mind that there's the frequency limitation. So you can't report them each time within that 7-day period. If a separately reportable face-to-face evaluation and management service occurs within 7 days of the e-visit, then the work devoted to the e-visit is considered inclusive of that face-to-face E&M service. So the bundling rules are really important here. And if your provider has seen the patient within 7 days of the e-visit, then it's not going to be reportable. So this is where it becomes really important that you have that solid infrastructure in place so that your patients are eligible for these services and you're going to be reimbursed. I've seen it happen too often in practices where they do these services and they don't necessarily check all the boxes as far as criteria before they start providing the services. So they end up doing a lot of services for free because they don't get reimbursed. And we want to avoid that if at all possible. So putting that time and effort up front really pays dividends as far as compliance and operational efficiency. And if you're thinking, well, I want to do this, but I have no idea where to start, feel free to reach out. You don't have to do this alone. A consultant like myself can help guide you from A to Z on how to implement these services and how to monetize them so that they can be a lucrative service for your practice, but also with peace of mind that you're doing so compliantly. And this brings me to my pro tip number 5. Understand the clinical documentation requirements for reporting each service type. So as we discussed earlier, they're essentially all considered online evaluation and management services, obviously taking into account some of the terminology differences. So first and foremost, there needs to be a permanent record of all e-visits in the medical record. So each entry requires permanent record, and then your patient consent is required. So we talked about this a little bit, but that needs to be documented in each note that patient consent was obtained. And then the provider who rendered the service, who is it, what are their credentials, and how did they actually evaluate and manage the patient. You cannot use these codes for, let's say, calling in lab results or something that's not direct evaluation and management. It has to be active management. And then the time-based criteria. So we talked about the thresholds. We do need to make sure that we're quantifying how much time was spent on these online E&M services. Keep in mind, clinical staff time may not be included in these services. So do not count that as part of your total time. And then make sure that your providers are not double dipping and counting time with any other separately reportable services like care management or remote monitoring or INR monitoring. There can be no double dipping here. This has to be a significant and separately identifiable service. So those are basically the minimum clinical documentation requirements for the online evaluation and management services. So just to summarize my top 5 pro tips for reporting online evaluation and management services. Understand the difference between online E&M services versus online assessments. Know the codes for reporting online services. Understand the time thresholds for each code. Understand how patients become eligible for these services. services and understand the clinical documentation requirements for reporting each service type. So it's time for this week's coding pro tip, and it's brought to you by Telehealth and Medicine Today, which is an open access, international, peer-reviewed journal where thought leaders, practitioners, and stakeholders converge to address strategic, medical, technical, legal, economic, and social aspects of digital health. Visit telehealthandmedicinetoday.com for more information. If you are interested in having a coding-related question featured in our Coding Pro Tips, please reach out to me on LinkedIn, Facebook, Instagram, YouTube, or wherever you frequent. I'd love to hear from you, and I'd love to have one of your questions featured in our Pro Tips. So one of our listeners from New York asked, what is the difference between online evaluation and management services and the virtual care codes G2010 and G2012? So this is a great question. The difference is the technology requirements for those G codes. So G2010 requires the provider to review photos or videos submitted by the patient to determine if a visit is required. And then G2012 requires a telephone or video check-in with the patient to determine whether a visit is required. The online evaluation and management service codes do not share these specific technology requirements. So that's really the main difference, which reminds me, please subscribe to our channel, rate us, like us, drop a comment below, and put a review on iTunes for us. We really appreciate your support. And the more reviews and comments we get, the more other people are able to see this information and benefit from it. And that's what it's all about. So this concludes today's episode. Until next week, thank you for listening to Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.